Hey there, and welcome back to Dr. Buddy Explains, the channel where we break down everything you need to know to keep your dog happy, healthy, and living their absolute best life. Today we're diving into a topic that honestly makes most dog owners a little squeamish, but trust me, you need to know this stuff. We're talking about worms. Not the cute little earthworms your dog tries to eat in the backyard after a rainstorm, but the parasites that can quietly set up shop inside your dog's body and cause some seriously scary damage if you're not paying attention. And here's the thing that surprises a lot of people. Most dogs will deal with at least one type of worm at some point in their lives. So instead of hoping it never happens to your pup, let's just get informed. Knowledge is the best protection you've got. And by the end of this video, you'll know exactly what to watch for, what each type of worm does, and what you can do about it starting today. Let's kick things off with probably the most well-known villain of the bunch, roundworms. If you've ever had a puppy, there's a very real chance they already had roundworms when you brought them home. That's not a slam on breeders or shelters. It's just biology. Roundworms can actually be passed from a mother dog to her puppies through the placenta before they're even born, and also through her milk while she's nursing. So these little guys have a head start before the puppy even takes their first breath. Adult roundworms look like spaghetti noodles, which, yeah, I know, not a great image when you're eating pasta. They live in the small intestine and eat the nutrients your dog is trying to absorb. Puppies with heavy roundworm loads often have that classic potbelly look, seem lethargic, and may vomit or have diarrhea. In severe cases in young pups, they can actually be fatal. The actionable tip here is simple. If you bring home a new puppy, ask your vet about deworming at that very first visit. Most vets in the US will recommend starting as early as 2 weeks of age, and your vet will set up a schedule. Don't skip it. Now here's one that catches people completely off guard. Hookworms. These guys are tiny, barely visible to the naked eye, but they punch way above their weight class. Hookworms attach to the lining of your dog's small intestine and literally drink blood. Think of them like tiny vampires with teeth. And here's the wildly unsettling part. They can also infect humans through skin contact, usually when people walk barefoot in soil or sand, where infected dog feces have been deposited. The ASPCA classifies hookworms as a zoonotic parasite, meaning they can jump from animals to people, so this isn't just a dog problem. In dogs, hookworm infection can cause dark, tarry stools, significant weight loss, pale gums from anemia, and weakness. Young puppies and senior dogs are especially vulnerable because the blood loss can happen faster than their bodies can compensate. Your action step: keep your yard clean, pick up dog poop promptly, and always wash your hands after handling it. If your dog's gums ever look pale or white instead of a healthy pink, get to the vet that same day. That is a potential emergency. Okay, let's talk tapeworms, because this one has a story that sounds like it was written for a nature documentary. Tapeworms need a middleman to get into your dog system. That middleman is fleas. Your dog accidentally swallows an infected flea while grooming, and boom, the tapeworm sets up inside the intestines. Those segments break off and are passed in the stool. You might actually see them around your dog's rear end or in their bedding, little white rice-sized pieces that may still be moving. Tapeworms rarely cause serious illness in healthy adult dogs, but they can cause weight loss, a dull coat, and that classic scooting behavior where your dog drags their butt across your carpet. The connection to fleas means solid flea prevention is your best defense. Products like Frontline, NexGuard, and Seresto collars, available through your vet or at retailers like PetSmart and Chewy, can break the tapeworm cycle at the source. Your action step: if you spot those rice-like segments, call your vet. The dewormer for tapeworms is different from the ones used for roundworms and hookworms, so over-the-counter general dewormers often won't cut it. Here's where things get more serious, so stay with me. Whipworms live in the large intestine and are harder to detect than other worms because they don't always shed eggs consistently. A stool sample at the vet might come back negative even if your dog has them. Symptoms can be vague at first: soft stools, mucus in the poop, occasional diarrhea, but in chronic infections you can see bloody diarrhea, significant weight loss, and a generally unwell dog. What makes whipworms especially stubborn is that their eggs can survive in the environment for years. So just cleaning up visible poop isn't enough to fully eliminate the risk. Your action step: talk to your vet about a broad-spectrum monthly preventive like Interceptor Plus or Sentinel, both of which cover whipworms along with several other internal parasites. Year-round prevention is way easier and cheaper than treating a full-blown infection. Now we need to talk about the one that makes every vet get serious real fast. Heartworms. If roundworms are the common cold of the parasite world, heartworms are pneumonia. Heartworm disease is transmitted through mosquito bites, so it doesn't matter if your dog never leaves the yard or never visits a dog park. All it takes is one infected mosquito. The parasite travels through the bloodstream and eventually takes up residence in the heart and lungs, where adult worms can grow up to 12 inches long. A dog with advanced infection may have dozens of worms living inside them. Treatment is expensive, involves injections of a drug called melarsomin, requires weeks of strict rest, and is genuinely hard on your dog's body. Prevention, on the other hand, is easy and affordable. HeartGuard is one of the most well-known monthly chewable preventives in the US, and there are several others your vet can recommend. The American Heartworm Society recommends year-round prevention for all dogs regardless of where you live, because mosquito season keeps expanding. Your action step right now, today. If your dog is not on a heartworm preventive, call your vet this week. If they're already on one, make sure you're giving it every single month. A single missed dose can leave a window open. Let's shift to one that lives outside the intestines, but still deserves your attention. Raccoon roundworm, scientifically called Bilisascaris procyanis. This one comes from raccoon feces, and it's dangerous because the larvae can migrate to the nervous system and eyes in both dogs and humans. If your dog roots around areas where raccoons hang out, digs in contaminated soil, or sniffs around woodpiles, there's a real exposure risk. Neurological symptoms can include loss of coordination, circling, eye problems, and in severe cases, seizures. It's less common than the others, but the severity earns it a spot on this list. Your action step. Discourage your dog from investigating raccoon latrines, which are spots where raccoons repeatedly go, often at the base of trees. Keep trash cans securely closed, and if you notice any sudden neurological symptoms in your dog, do not wait. Get to an emergency vet immediately. One more you should absolutely know about. Lungworms, specifically Angiostrongylis vasorum, sometimes called French heartworm, and Crenosoma vulpis. These worms set up in the lungs and associated blood vessels. Dogs typically pick them up by eating infected slugs, snails, or frogs, which can happen accidentally when a dog sniffs around the garden and chomps on something without you even noticing. Symptoms include a persistent cough, difficulty breathing, reduced exercise tolerance, and in some cases bleeding disorders because certain lungworm species interfere with blood clotting. This parasite is gaining attention in the US as its range expands. The good news is that some broad-spectrum preventives, including certain formulations of Advantage Multi, cover lungworm. Your action step. If you have a garden-loving dog and notice a cough that just won't quit, ask your vet specifically about lungworm, because it's not always the first thing on the diagnostic list. Here's what ties every single one of these worms together. Most of them are preventable, and all of them are treatable when caught in time. Stay current on a vet-recommended broad-spectrum parasite preventive. Schedule at least annual wellness exams that include fecal testing. Keep your yard clean. Control fleas. And do your best to stop your dog from eating random things off the ground, which I know sounds nearly impossible, but try. The FDA and the ASPCA both have solid online resources about parasite prevention if you want to dive deeper after this video. And please don't fall for outdated natural deworming myths online. Things like diatomaceous earth or garlic have no scientific backing for internal parasites, and garlic is actually toxic to dogs. Your vet is always your best partner in this. Thank you so much for spending this time with us today. The fact that you watched all the way through tells me your dog has a really great owner. This is exactly what Dr. Buddy Explains is here for. Real, useful, science-backed information that doesn't put you to sleep. If you got something out of this video, please hit that like button. It genuinely helps more dog owners find this channel. Subscribe if you haven't yet, so you never miss a new episode, and drop a comment below telling us what topic you want next. Dog nutrition, anxiety, dental health, something weird your dog does at 3 in the morning. We want to know. Until next time, give your pup a big squeeze from all of us here at Dr. Buddy Explains. You've got this.